Meanwhile, Presidential Advice on Health, Dr. Anthony Nsiasare, has announced that the government is working towards having at least 15 centers across the country to test everyone who has come into contact with a COVID-19 patient. The centers would have a combined capacity of testing 200,000 samples. At present, tests are conducted at the Noguchi Memorial Institute for Medical Research in the Greater Accra region and the Kumasi Center for Collaborative Research in the Ashanti region. Addressing a sensitization program on COVID-19 for senior journalists in Accra under the auspices of the Ghana Journalists Association, Dr. Nsiasare said some ACR machines in some of the health facilities would be calibrated for testing the virus. Now, Dr. John Amwesi is a lecturer at the Global Health Department, School of Public Health, Kwame Nkrumah University of Science and Technology, and leader. He's also with the Global Health and Infectious Diseases Research Group at the Kumasi Center for Collaborative Research in Tropical Medicine. He joins us. Thanks for your time, sir. Scary conjectures we're hearing about how this pandemic could affect us. What are your thoughts on the rate of spread now?
Well, thank you very much for having me on this morning. It's a pleasure to be with you and also to be able to interact with your listeners and make a contribution, which hopefully will add on to what several of your speakers have already touched on and hopefully bring us to the place where we'd like to be, which is to be free from this COVID-19. It certainly is of concern, the fact that we are seeing more cases and particularly the additional deaths that we had. It certainly points to the fact that the disease is in the community and everything that needs to be done to reduce or limit the spread and its impact needs to be done quickly. I could comment on a couple of things, and I do realize that a lot of speakers have been speaking about a lockdown, which
yes,
is likely.
First, I wanted your thoughts on the rate of spread.
Well, on the rate of spread, it's a bit of a tricky situation because all we have is the information on the number of cases that have been announced so far. And the rate at which cases are popping up suggests that what we are seeing is only the tip of the iceberg. If you follow the models that have been developed by other countries, looking at the rate at which cases are being detected here in Ghana, one would even suggest that we are seeing a rate of spread which may be even faster than what has been seen in other countries. But our challenge is how good the eyes that we have to see are. We are limited in our ability to see. And if even the little we are seeing is this, then the reality of the facts are likely to be much larger. And this needs to be acknowledged.
If you look at the announcement of infections, it seemed, is it, and you are in the field, so you can attest to it if this is correct. Is it to calm the populace? There are some people who suspect that we probably even have more numbers, but we're just taking our time because we don't want to scare anybody.
No, I'm very doubtful that there is any conspiracy or any effort to not let people know the true cases. From my understanding of the way things work and my proximity to the activities that my colleagues, the virologists, are carrying out here at the KNUST campus at KCCR, I could assure you that there is definitely no attempts to cover up the reality of the number of cases. Certainly, in announcing the number of cases, certain processes and procedures would need to be followed. So even if a case is identified at a certain time T, it certainly would be a couple of hours before an announcement is made, or announcements will be made at the close of the day and given updates. But it would be very difficult for any cover-ups of any sort to be made. What we believe is that what we are seeing is the tip of the iceberg, and we can only talk about what we can see. But what we cannot see, we can only speculate, not just empty speculation, but based on what we've seen going on around the world, and also scientific knowledge about the way diseases spread and our ability to even crudely model it based on the way in which our society interacts.
Great. Let me get your take also on this major exercise carried out, at least in the Greater Accra region. Our understanding is that it will go across the entire country, and I'm talking about the disinfection exercise carried out in some 100 markets in the Greater Accra region. What would that cure really?
I think the disinfection exercise was a step in the right direction, but as I said on Saturday when I was on News File, we will encourage our authorities, but we will also criticize as academics whenever we need to. I think that the disinfection exercise would be analogous to perhaps a drop in the bucket. And one would say, yes, a drop is still a drop and it's worth something, but it is definitely not enough. So it's a step in the right direction. But my concern is all these activities that invariably cause discomfort and inconvenience people must end up being beneficial. So there's really no point. They're taking activities which will massively inconvenience people and they do not meet the objective. Then it becomes not worth it. And this is what I would like us to avoid.
You've also suggested comprehensive research to the dynamics of the COVID-19 and how it is likely to affect us as Ghanaians. I want us to break it down. Who plays what part in that?
Yeah, I'll try to explain what I meant by the role that research plays in all this. Research is meant to provide knowledge and information so that those who have the power and the responsibility to develop policy and enforce regulations can do this with a clear sense of understanding and objectives regarding what they want to achieve. We can already see from various countries different activities that they have undertaken, the results they have gotten, and use that to advise ourselves. I'll give you an example. We already see that Hong Kong is thinking of, or actually will be moving into another phase of lockdown. The reason being because they embarked on a lockdown exercise, did massive testing across the board, and they realized a very dramatic decline in the rate of spread of new cases that were being seen, and thereby mortality as well. However, they relaxed this a little bit too early, and we're beginning to see a rebound, and so they're going back again. So this already tells you that the period of a lockdown is very, very critical. Now, the period of the lockdown and several other measures that will be undertaken, it will need to be informed by the way societies work and also by the way the disease presents clinically in our setting. I mentioned that we're only beginning to see a large number of cases in Africa, even by the day. I mean, they're accumulating across the continent. And until we systematically collect information on the rate of spread in our subcontinent, the clinical presentation of the disease, already we have information, not from Africa at least, but from Europe, suggesting that one of the first signs of the disease is the loss of smell. Now, how can you know this unless we're very systematically collecting information? So what we as researchers are asking for is for very strong and close partnership with the Ministry of Health and with the Ghana Health Service. And we're already on to this. So far, the cooperation has been great. Some of us researchers have already submitted protocols which are being looked at by the necessary ethics committees to ensure that these are done in the right way. Okay. Once we get the feedback, we will be able to launch research. But the challenge in conducting research in here is that research is viewed as something extraneous to the clinical care and to the prevention and control efforts, but really it is not. It's an important integral part of it, especially for a disease like this for which we know so little. So we literally have to learn on the go. So we'll have to be changing and tweaking things as we move along. And unless we are collecting information that may not necessarily inure to the benefit of the specific individual who is down with the disease, or the specific individuals in the community who we go to and ask questions, or the health workers to whom we pose certain questions. Unless we realize that this information may not be immediately beneficial for them, but would be very important to collect, aggregate, and inform policy, we will have difficulty.
Great.
And this is a challenge that is faced not only in the African subcontinent, but across the world, integrating the research with the clinical care and the control and prevention efforts.
Okay, so do I get the understanding that we're trying to do the research with the numbers that we've recorded?
So far, no, because there has been, there has been no approval of research to go on. However, I must mention that there is some systematic data being collected, but it is not being used for research purposes. It is just meant to provide the direct clinical care for the patient and also to inform the contact tracing activities. But beyond this data being collected, what I'm talking about is data that goes beyond the care for the individual and for contact tracing.
Yeah, I do get that, but I do get that, Doc. I was hoping that at least with the cases that we've recorded, if we can begin to analyze it and see, where that is also going. But, just before we continue with this conversation, there's a person joining us who is in, not self-quarantine, this is compulsory quarantine. He's been listening into our conversation. Just want to engage him briefly, and then I'll come back to you so we can wrap up with this conversation. But this person is actually a pharmacist. He says he's calm in quarantine, though not very convenient. So thank you very much for joining us. We've been keeping you company. Otherwise, tell us what you've been doing.
Thank you very much for the opportunity. I think basically I've not been doing anything really, just in the hotel room. They bring food. In the morning, you go and check your temperature at the health post. And when you need something, you call the reception for them to deliver it for you. Movement has been restricted at this place. We are not allowed to move about. In fact, there is security present, both police and military. So when you move about, they'll politely tell you to go back to your room, unless you are going to the health post to check your temperature or your other vitals. But most people are just confined to the comfort of their rooms. And then if you have TV, you watch. If you have Netflix or YouTube, you just stay in your room and then do so and wait for meals to be brought into the room. So that's what we've been doing here, or that's what I've been doing here.
Great. So how many days into this quarantine?
Well, I was brought here Saturday evening. My flight arrived in Ghana at 8 p.m. We had to wait at the airport. I think we were the first batch, so we waited a while. So I was brought here around 12 midnight on Saturday. So I've been here for, let me say, 2 days or 2 nights.
How long are you going to be in the hotel for?
We have not been, there is no communication as to how long we are going to stay here. I keep asking the health personnel who come around. They seem not to have the information. We ask the health personnel at the airport and also the immigration officers. They also seem not to have the information. The hotel, the receptionist, and those at the hotel also seem not to know when we'll be leaving here. Yesterday, people came to take samples for the test. They also didn't know when or how long I'll be kept in the hotel.
Okay, so was this your very first test since Saturday?
Yes, since Saturday.
Okay, but you don't know when you will get the results?
I asked the people who took the sample. They picked it yesterday at 6 p.m. and they said the results will be ready in 24 hours. But your results might not be communicated to you unless you are positive. So I don't know whether they will communicate the results to me or they will not communicate it as well.
So how is the waiting period like?
Please, waiting in terms of?
Waiting in terms of the results, waiting also because you are in compulsory quarantine.
Okay, so in terms of the results, let me answer that one first. I'm not anxious. Of course, I traveled to Nigeria where the number of cases there was even lower than Ghana. And even in Nigeria, I was confined. I was doing
at the time
a bit of work in confinement. So my exposure to the public has been very reduced. But waiting in terms of the quarantine, I think I'm not a very indoor person. But due to this COVID-19, I've had to be indoors. So I think it's been more of reflections for me. I've not had time to go off the public for myself this like this period. So it's been more of reflections for me. I've been thinking about the next step, my life, family, and all those things. So it's very difficult for me, but I totally understand why it's happening.
How many of you were on the flight?
22.
So this is just from Nigeria to Ghana?
Yes, please.
Okay. And how is the reaction of the hotel staff? Because you say you're being kept in the hotel. Tell us about catering as well. How do you manage to eat?
Okay, so the first night, most people didn't have dinner. But when we got to the hotel, they didn't serve dinner for us. And then on Sunday morning, most people were hungry. So I peeped through my door and I realized that they were trooping towards the reception. But we were all advised to stay in the hotel. So they usually bring the meals to your room. Breakfast they bring the breakfast around 9 a.m. Lunch somewhere after 1, and then dinner 6:30. So they bring it to your room.
So everything served to your room?
Yes.
How...
Everything packed in a foil, and then they'll deliver it to your room. Okay.
Is there a particular meal you're being given, for instance, to boost your immune system?
I have my immune boosters here. I bought some immune boosters in Nigeria, vitamin C and Immunis. I mean, they are drugs that I bought. However, I think it's the regular meals. Yesterday, for instance, they gave us rice and beef sauce in the afternoon. They gave us rice and then vegetable and then stew in the evening. And then in the morning, it was normal bread and then sausage and egg, boiled egg. So I don't, maybe on Sunday they gave us some fruit, but yesterday there was no fruit. But I realized that there's a conscious effort to increase the vegetable content in the meals. Because the lunch had some vegetables, also the dinner also had some vegetables. So I think there's a conscious effort to increase the vegetables in the meals.
So do you go, so you said you go out of your hotel, but only to the health posts?
Yes, we are only allowed to go to the health post. You are not allowed to walk out. You know, La Palma has a very wide compound, but you are not allowed to walk. If you are walking around, the security persons will tell you to kindly go back and confine yourself to your room. It is only when you are headed towards the health post, they will not stop you.
So I guess you don't receive visitors, family members?
Not at all. In fact, somebody wanted to bring me some food, but the person was denying access. Even the food was not allowed to enter the hotel. I think the instruction is that nothing in, nothing out. So, no visitors, nothing at all.
Well, this is uncomfortable, but from the way you describe it, sounds like a nice hotel. So enjoy the holiday then.
It's not a holiday because I'm confined. Thank you.
Thank you very much. Let me get back to Dr. Mwesi. You've been holding on. I wanted to ask you about the lockdown, but maybe just some few seconds for you to comment on this compulsory quarantine. There are quite a number of people who traveled, returned, and the state is keeping them in hotels.
No, I think that was a very interesting conversation you had with the gentleman, and we appreciate him for sharing this first-hand experience of being on the quarantine in the hotel. I think we all do realize that his circumstances of quarantine are what you call the ideal circumstance, where you have a fairly okay room which is self-contained. You have a bathroom to yourself with running water, and you have access to food being supplied 3 times a day. You have access to the internet, you have access to a phone, and you have access to television. So the challenge really is the lack of physical contact with any other human beings, which is challenging. I was listening to the experience of one person who had been quarantined in Singapore, and she had everything that she needed, but again, commented a lot on the difficulty of being away from people, especially loved ones, after 2 weeks. So this should tell you that the whole issue of a lockdown is a challenge. I was speaking to a good colleague of mine in Spain earlier this morning, just asking her of the experience of being on lockdown. And she's also a medical doctor and a researcher, and was explaining to me how really, really tough this is. It's much more difficult than we think. And I think at this stage, it would be very important for us to hear more of each story from different perspectives and to prepare ourselves psychologically, not only physically, but psychologically for what, if there is a lockdown, what it would mean for us and to brace ourselves for the potential psychological impact that it would have, which is almost unavoidable.
So various people have ideas for lockdown. Some say, well, we know the incubation period for this disease. Why don't we lock ourselves up for 14 days and see if anybody shows any symptoms, and then we can deal with it after 14 days? We should all be okay.
No, you pose a really good question, and this is where my harping on the need to collect data from our setting is very important. Because I can tell you that if you listen carefully to the stories around at least some of the cases that have been identified, it brings into question even this incubation period of 2 weeks as to whether it is really accurate and how it's really panning out in our setting. Because there is indication that people could be asymptomatic for much, much longer. In my view, from the little we know regarding the impact of the lockdown, 2 weeks may be insufficient, at least what we saw in Hong Kong. What we've seen in China and Wuhan is only now coming out of the lockdown. 2 weeks is likely to be insufficient. And you asked me to comment specifically on the lockdown. I would like to say that the objective of the lockdown must be met. Otherwise, it becomes a painful exercise in futility. And the two key things that need to be observed with the lockdown would be the duration of the lockdown and the intensity of the lockdown. Spain and Italy have been accused of starting their lockdown too late and also not enforcing it strongly enough, where people were adamant and some people were still going out for a run and for a jog and to exercise a little bit and to do this and that. This will not work. However, just suddenly locking up the whole country would be a challenge. All right. If you see what happened in some countries, what they did is that they tried to close off the borders or the entry points to various towns, cities, and villages which did not have any cases. It's very clear so far we have cases in Accra and cases in Kumasi. I don't know whether it's too late, but we know that there are some areas that may not necessarily have any cases. We could look at a staggered lockdown. We could look at a simulation type of lockdown like the Indians did last week before actually embarking on one. We need to consider issues of security for health workers and general security for people. We need to look at things like phone and internet service and also look at food supply. I'm very sure that authorities are on to all these things. But beyond the lockdown is the fact that there will be very, very negative implications and impact of the lockdown. People will die because of the lockdown. But the question is, will the benefits of the lockdown outweigh the negative effects? And we must ensure that ultimately the benefits outweigh the losses. Otherwise, it becomes a painful exercise in futility.
Okay, sorry, sir. You just said people will die because of a lockdown. Can you explain that real quick in about 30 seconds?
Yeah, and what's happening is people with comorbidities, people who need to be in the hospital, people who need to get their insulin supply, people who would have a heart attack and need to be rushed to the hospital, people who would have maybe an accident and need to get some help, it will happen, okay? There will also be some people who are ill prepared for a lockdown, who will not have enough food, who will not have enough supply. And it will be a sad situation. There will be collateral damage, all right, which will lead to some loss of life. But the question is, will it be worth it? And we must make it worth it by doing two things, looking at the duration of the lockdown and the intensity of the lockdown.
I thank you for your time, sir. Thank you for spending time with us. That's Dr. John Amoisi, who is a virologist and a researcher. Now, here's the Ghana outlook of the situation. So far, we've recorded 27 cases and we have 2 deaths out of the total 27 cases that we've recorded. We've traced over 500 contacts of these persons so far, according to the Deputy Minister of Health, who appeared on PM Express last night. But globally, we have 383,944 still counting, and the deaths 16,595 still counting. The recovery, though, is remarkable. Over 101,000 of the recoveries. The World Health Organization has warned that the coronavirus disease pandemic is accelerating. Meanwhile, as you can see, we have over close to 400,000 cases now. It took 67 days from the first reported of COVID-19 to reach 100,000 cases, 11 days for the second 100,000, and just 4 days for the third 100,000. So that's the picture that it paints, really. It's certainly a very deadly disease.